Premedication. In the current day practice of anesthesia, patient is premedicated with a purpose, not a routine procedure. If given, the premedication is given with the following goals. Premedication goals: to relieve anxiety, to produce hemodynamic stability, to induce sedation, good sleep, to avoid anesthesia and amnesia, to decrease the chances of aspiration, to control oral and respiratory secretions, to prevent postoperative nausea and vomiting, to control infection. To relieve anxiety. Relieving anxiety is the most important goal is present-day anesthesia. Nothing can be more helpful in relieving the anxiety of the patient than preoperative visit of the anesthetist, clearing the patient's doubts, fears, myths, and explaining the anesthetic technique. Benzodiazepines should be used only for the patients where assurance by anesthetist is not sufficient, or for pediatric patients. In the current day surgical practice, where majority of the patient are getting admitted on the same day of surgery, the benzodiazepine of choice is midazolam. To produce hemodynamic stability, clonidine was recommended for hypertensive patient in past but not used nowadays. To provide analgesia, opioids are given intravenously just before induction to provide analgesia and to attenuate cardiovascular response to laryngoscopy and intubation. To decrease chances of aspiration, the best way to reduce the chances of aspiration is by keeping the patient fasting. Therefore, the drugs for aspiration prophylaxis, metoclopramide, antacids, and blockers, ranitidine, should be employed only patients who are at high risk of aspiration, such as hiatus hernia, pregnancy, not routinely for every patient. To control secretions, anticholinergics available to control secretions are atropine, glycopyrrolate, and scopolamine. Anticholinergics can cause dry mouth, which can be troublesome to patients, therefore they should be used only when required, like oral surgeries where dry mouth is the requirement of surgery, not routinely in all patients. Glycopyrrolate is a preferred anticholinergic over atropine and scopolamine because it does not crosses the blood-brain barrier, therefore is devoid of central side effects. To prevent nausea and vomiting, drugs which can be used for antiemetic prophylaxis are Hosina, 5-HT3 antagonist, ondansetron/granisetron, metoclopramide. Current day recommendation is to use antiemetic prophylaxis only for the conditions associated with higher incidence of postoperative nausea and vomiting, like middle ear surgeries, not routinely to all patients. In current day practice, 5-HT3 antagonists are the first-line medications for prophylaxis as well as treatment of postoperative nausea and vomiting. To prevent infections, the timing of antibiotic should be adjusted so that the peak blood levels are achieved at the time of skin incision. Therefore, antibiotic prophylaxis must be given within 60 minutes before skin incision. Thank you for watching.